And here is the main entrance.
Okay.
And here is the hall, and also some, that is for the emergency.
The DeKINDREN Hospital on the west coast of Demerara under construction. This is what it will look like when completed. It's one of the most transformative healthcare projects ever to be undertaken in Region 3.
We are trying to finish that within 3 months.
The entire hospital you're going to finish in 3 months.
Exactly.
Is that really going to happen?
We hope that for,
Okay.
and we plan that.
Lei Yang is the project manager of CAMC Engineering Company, a subsidiary of Sinomac, the Chinese company contracted to design, build and equip the hospital. He showed me around the site, explaining some unique features of one of the 3 surgical theaters this hospital will have.
All the materials for the theater installation is on the shipment now. I think it would be 1 week or 2 weeks later arrive, and we will start installation of the theater. It's a very special one. Normally we use the wall. For example, like this one, we make the wall here and the bricks one by one, lay the bricks. But for that part, we only use electrical panel, electrical steel panel. So very special material and well aged. So it's kind of easier for installation and very easy for the future maintenance.
The top floor of the main building will have 2 surgical theaters, and there will be another one in the emergency department on the ground floor. The hospital caters for male and female wards to accommodate 75 patients.
And this is for the five-person room, patient rooms. In the future, there are 3 beds here and 2 beds here. There's the separated bathroom.
Okay.
So each one is separated, the same design.
Currently, the West Demerara Regional Hospital at Best Village is the main hospital in Region 3. It is perhaps the oldest existing hospital in the country and is unable to keep up with current demands of a growing population and modern medicine. Dr. Erica Fort, the Regional Health Officer who manages healthcare in Region 3 for the more than 120,000 people who live here, is upbeat about the services the DeKINDREN Hospital will provide. Tell me how this regional hospital at DeKINDREN will change things for you.
Well, this regional hospital, DeKINDREN, will massively change things for delivery of health services in Region 3. The DeKINDREN Hospital will offload a large population of persons in terms of allowing them access to regional hospital level care at the Tusha and DeKINDREN area, because that area is also the West Coast, being the more heavily populated area as compared to the West Bank. So a large population, more than half of the region's population, will be able to access a facility that is supposed to be state-of-the-art. This facility will offer surgical services, inpatient services, radiology services. I believe a CT scan will be there as well. So it's not just that we're going to give you what you can get at West Dem. We will improve on what the West Demerara Regional Hospital will be able to offer you by offering CT scans and so on. So it's supposed to be like a one-stop location. You go there and you get all your services from emergency care straight up to inpatient surgery and so on. That will obviously offset the GPHC. Persons there will be able to access all the services without having to travel across the river.
Because I was going to ask you if this will be the one-stop shop and you'll stop referrals to GPHC, or there will still be some of that?
Well, there may still be referrals needed for GPHC for extra specialist care, like neurosurgery and so on. Of course, I will not be able to say at this point in time exactly what the specialist services will be, because those are dependent on staffing as well. But I do know that it will have the capacity to take off everything that would be needed to go to GPHC should we have the specialist care there.
What sort of services would the hospital at DeKINDREN offer that you don't offer at Best Hospital?
So at Best Hospital, we all know that the facility here is a bit aged. While we are still working with what we have, what you will have will be up-to-date services. So you'll have a better patient flow, because as you know, medicine is constantly evolving and the need of the medical service is constantly changing. For example, at West End, we still don't have an elevator for the wards and these things. Now, while we are able to manage as it is not the best care for patients, and that is why Minister has really pushed and the government has really pushed to ensure these services have been improved upon. So simple things like getting patients up to the ward, timelier surgeries. We will be able to improve on the amount of surgeries, because right now now at the West MRI Regional Hospital, the makeup of the operating room is 2 operating rooms. So of course that limits the amount of surgeries we can do on a daily basis. With more operating rooms that are better equipped and are more up to date, we can have faster turnover times for surgeries. So where you may be able to do 4 or 5 surgeries here on a regular work day, you would be able to do more at DeKINDREN. So it's not just that we would be able to offer better surgeries, because certain things like newer surgeries like kidney transplants and these things require certain specifications for the operating room, which we do not have here simply because the structure is old. It's older than you and I. So the new structure will be able to allow for this. So we can introduce newer surgeries, newer techniques, but we can also cut down on the surgery time and also improve and increase on the amount of surgeries done on a daily basis.
The DeKINDREN Regional Hospital is part of the government's ambitious plan to build 6 regional hospitals across the country. Once completed, this hospital at DeKINDREN and the 5 others being built will employ a full complement of healthcare professionals, from doctors and nurses to specialized technicians. The DeKINDREN Regional Hospital is expected to be fully operational within months. It's a significant step toward reducing healthcare disparities and ensuring that every Guyanese has access to the care they need, no matter where they live. Reporting for the newsroom, I'm Neil Marks.